This is the clinical examination of the lumbar spine by Dominique and Jarrett.
Okay, I'm going to show you guys straight leg raise. What we're going to do is we're going to take the patient's involved leg, we're going to lift it up until we feel tightness, and then we're going to ask them if they have any pain or paresthesia. If they don't, then we're going to take the foot and dorsiflex it like so, and again ask for pain or paresthesia. If they do, that would be indicative of sciatic nerve pathology.
All right, so for the bowstring test, first we are going to raise up patient's leg to about 20 degrees. Are there any recreation of symptoms? So if not, then we're going to go in the popliteal fossa and apply pressure to the nerve, and we are also looking for the recreation of symptoms for this. Anything?
All right, I'm going to do Koenig's and Brzezinski's next. So first we're going to do Koenig's. We're just going to flex the hip to 90 and then put the leg no further than 90 degrees. And then we're going to ask the patient if they have any recreation of the pain or paresthesia. If they don't, then I'm going to have them do what Dom just did, put their hands behind their head and lift their head up, again looking for recreation of pain or paresthesia. And this would be indicative of a nerve root issue.
So next we're going to be doing Milgram's test. What we're going to do is we're going to instruct our patient to lift their legs off the table about 6 inches, and we'd have them hold it for about 30 seconds. Now a positive test would be if the pain was recreated during that 30 seconds, if they could not hold up their legs for 30 seconds, and this would be positive for joint dysfunction.
I'm going to show you guys Valsalva's maneuver. I'm going to place my hand in front of my mouth and I'm going to blow into my fist like this.
No way. All right, so this is the slump test. So we're going to instruct our patient to create the worst posture possible. Yep. Tuck your chin in to your chest, and then go ahead and raise one leg for me. Are there any tingling, numbness, any recreation of your symptoms? All right, then dorsiflex your foot.
All right, I'm going to show you guys stork standing test. What we're going to do is we're going to have Dom over, yep, just like tree pose. We're going to have her stand like that, put her arms out, and we're going to have her extend back like so. We're looking for any pain, and if there's pain, it's indicative of spondylosis. Okay, now we're going to do prone instability test. You're going to have your patient lean over the table, and then they're going to be standing. She can barely touch the ground, but they want to be standing. I'm going to put my hand right here on her low back, and I'm going to push down, looking for the pain or paresthesia. Then I'm going to have her lift her legs up for me, about 90, up, there you go, perfect. And then I'm going to push down again. A positive test is if she had pain with her feet on the ground, relieved when she lifted her feet up. and that would be indicative of lumbar instability. Okay, next we're going to do the quadrant test. What we're going to do is have the patient extend back and then rotate to the side and kind of come back a little more. If we get radicular pains, and then I'm going to do overpressure on her shoulder. If she has radicular symptoms, that would be indicative of an interforaminal compression problem. And if she has local pain, that would be a facet issue, and we would do it on both sides. Okay, we're going to do Adam's test next for scoliosis. If you notice your patient has scoliosis or curvature of the spine, obviously we would have her with her shirt off and a sports bra or something, preferably that you can see the spine. But we're going to imagine she has a curve right here. So we notice that. So Adam's test, what we're going to do is notice it there, and then we're going to have her bend forward like she's going to touch her toes. And as she goes forward, we're going to be looking for either a rib hump where one side of the rib is going to be popped up, and the curve will stay. If it stays, it's congenital. If she leans forward and the curve goes away, it becomes straight, that means it's functional scoliosis.